Gymnasts are a common athletic population that we see across all of our locations at Rehab to Perform. And with this population, we are often dealing with individuals who are having pain throughout their competitive season, and it's preventing them from performing pain-free, but it doesn't have a medical diagnosis or an injury associated with it that would be inappropriate for them to participate, meaning it often falls under that as tolerated injury. So there's no medical reason as to why they cannot play, but we are mindful of the fact that they are having some degree of pain, some degree of discomfort, and it is exacerbated with their physical activity. These are the tough individuals to deal with when they come in for PT, because they want to know what can they do to help influence their pain, influence their symptoms, and ultimately perform more comfortably and at their highest level. And the most provocative thing that they're doing is actually their sport itself. So common sense almost makes you want to say, well, let's take some time off, let's let things calm down. But I think we really need to step back and take an aerial view at this and figure out what's predisposing this athlete to the discomfort or to the injury in the first place. Things that often come to mind, I think common areas are low back pain, and lower leg injuries. So whether it's Achilles issues or ankle issues or maybe shin splints, something along those lines, but they often tend to be repetitive stress or overuse type of injuries. And one of the largest correlating factors with these types of injuries is their overall program design, meaning what's their training frequency, what's their training volume, and what's their training intensity. And of those three variables, the higher the frequency, the higher the volume, the higher the intensity, you are more and more likely to have some of these overuse injuries pop up. Now, other areas that we need to explore though are, what is this individual having discomfort with? Are they having discomfort with specific moves in their routine? And if so, is that something that's just more of a skill acquisition that they need to work through with their gymnastics coach and their instructors? Or are they moving in a manner that's placing more stress and more demand on areas of their body because they lack the prerequisite physical qualities to do that movement in the most biomechanically efficient manner that also meets the demands of their sports from an aesthetic standpoint? So common examples that I see with low back pain are individuals that it's rare that a gymnast lacks the mobility to carry out a task. They're often gravitating towards gymnastics because they are hypermobile or very flexible individuals. And that's why they're good at gymnastics, because they can get in and out of these positions that a lot of other athletes and just the general population cannot. But it sometimes can be common, I think, when we look at overall extension. So think of like a multi-segmental extension or a back bend or a back handspring or a back flip. Sometimes we tend to lack maybe some of the hip extension, mobility that we need due to hip flexor tone or hip flexor tightness. And that causes us to extend through the low back a little bit more. Or maybe we're a little bit more rigid through our thoracic spine or through our shoulders. And because we lack overhead motion, we need to pick up that extra extension somewhere, and it tends to come through the lumbar spine. So with the incidents where it's a low back pain individual, intolerance to extension, assuming that we've ruled out a spondy and some of our other red flag issues, it's important to look above and below that area of interest and make sure that we have the prerequisite movement qualities and movement capacity to get in and out of those movements effectively, and we're not placing more demand on the lumbar spine. More commonly, what I've found though is it's often less a lack of a mobility and usually a lack of just motor control and body awareness with how they are doing certain tasks. Now, the tough thing with gymnastics and some of your performing arts is there's a certain way they need to do the drill or they need to do the skill and activity because that's how it's done in the sport. Even if it's not the best way for your body to go through that motion, it's the way that it's designed to be done in that sport. But there are some individuals that tend to over-exaggerate some of these motions because they lack the awareness or the stability either at that body segment or the adjacent body segments to control that motion. And they're going into exaggerated amounts of lumbar extension because they lack anterior core control or they lack some of this other core stability or maybe overhead stability that's causing them to get into excessive ranges of motion and place unnecessary stress on those areas. So when they come in for PT, a lot of what we're trying to figure out is, what's this recipe of symptom provocation look like? Is it due to training volume? Is it due to mobility deficits? Is it due to strength or motor control deficits? And how much of that can we readily influence in the clinic? And what I tend to find myself doing with these individuals, if they're still continuing to practice and compete on a regular basis, I'm not going to go overly intense with my PT sessions because they're getting a lot of frequency, volume, and intensity outside of the clinic. So my sessions tend to focus more for that low back patient on body awareness, core stability in lower impact environments, making sure that we're training within comfortable ranges and we're finding ways to load the back and the core and the abdominal muscles in positions and through motions that are not going to provoke their discomfort, but are still going to provide that either neuromuscular stimulus or that strength stimulus that we need to build up the area of interest. Another common area that we'll find for the that we talked about was the lower body. And these are athletes that are coming in with shin splints or Achilles issues, and all day long at practice, they're sprinting, they're jumping, and they're landing. So part of that is just a volume-based injury, but where we tend to often find deficits with these individuals is with just localized tissue strength. With this individual, maybe the gastrocsoleus complex. What does our just overall strength look like at this area? And gymnasts tend to be master compensators, meaning they're very good at utilizing momentum and the power that they're able to do motions in to mask some of these underlying strength deficits that they have. And that tends to put some more stress in areas that otherwise wouldn't need all that stress going through them. So with these individuals that have the lower leg injuries, oftentimes we're focusing on strength training with them, and we're building up overall strength in relation to their body weight, but also with external load. And we're doing it in a manner where we're very intentional about the tempo that they're doing. So maybe we're intentionally slowing them down to like a 3-second descent and a 3-second ascent through the eccentric and concentric phases. Maybe we're doing long duration isometric holds, but we're doing something to provide a strength stimulus that removes or reduces the stretch shortening cycle, targets the tissue at hand, and does not provoke either that bony irritation that they have, the tendinopathy that they may be dealing with, or just the, in general, soft tissue issue that they are dealing with. So gymnasts tend to be, they're a very fun population to deal with, but they can be tricky because oftentimes they have high pain thresholds, they're extremely motivated to keep participating, but when they're constantly having these little flare-ups while they're at their sport, we need to figure out what qualities and impairments can we enhance outside of their sport within our clinic that's going to translate best to the skills they need to express without provoking the symptoms that brought them in the first place.